Retirement is often seen as a destination, but we believe it's an opportunity to pursue your passions, realize your dreams, and live a purposeful life. Great decisions, incredible lives. Retire with Intention podcast is about more than just money. It's about embracing the things that truly matter, the experiences, the relationships, and the impact you leave behind. Here is your host, John Creekmur.
Hey everybody, welcome back to Great Decisions, Incredible Lives. John Creekmur with you again this week, and I'll tell you what, so excited to introduce you to Kate Granigan and kind of walk through just really her background. We're going to walk through a lot of things that she is so passionate about. I want to give you all a quick shout out. As you guys know, we've been having interviews over the last year and a half, had a lot of fun, a lot of variety of people that really have got a unique message about how we can make better decisions, live an incredible life. And you know, it's just been interesting, the number of people. We've had some technology CEOs of tech companies. We've had some CPAs and attorneys, had a lot of different conversations with clients of ours. We have people from all different backgrounds, and the feedback is just phenomenal. And I'm not sure the last number, somewhere 15 to 20,000 downloads a week, which is just an incredible amount. And we actually took 12 of those interviews, a lot of you are aware of this, and put it into a book. And here's a copy of the book. It just launched this last week. And Your Blueprint for Purpose, Build the Life You've Always Dreamed About. It was an Amazon.com bestseller in 3 categories, which it just blows me away. It was the number one sold book over a 24-hour period. So it's kind of crazy. Just the resource and just the incredible people I've had a chance to talk with. And Kate, there's no exception today. I'm so excited to have you with us today. And Chief Executive Officer at LifeCare Advocates, a leader in the aging life care space. And, you know, we had this baby boom population born 1946 to 1964. So the front edge of that is, oh, goodness gracious, 78 years old. And the youngest is 1964. I guess the goodness, they're 60 years old now. But Kate, you know, this is a topic that is near and dear to my heart. My father passed away 3 years ago, 3.5 years ago now. My mom, 79 years old, and has got some struggling issues she's walking through. And then also my father-in-law recently and earlier this year, about 6 months ago, diagnosed with Alzheimer's. And so we're walking through that as a family. And so to say I'm eager to hear from you today,
Sure.
probably going to be an understatement. And I know we have a lot of listeners and a lot of friends of our firm and also of our community that are walking through a similar thing. So without further ado, Kate Granigan, thank you so much for joining us. Can you introduce yourself and also give a little background of who you are and what you do?
Sure. Well, John, I'm thrilled to be here today. As you said, this is a topic that is, really near and dear to my heart, my passion. My background is I'm a clinical social worker by training. I got a master's degree in way back when, in the 90s, in social work at Boston College. And interestingly, at that time, I really did not have a plan to work in geriatrics or with older adults. At the time, it wasn't even a specialty. It now certainly is. And so I started it with a master's degree and worked with families and children. And then fast forward, found my way to a visiting nurse association by luck and never looked back. I fell in love with the population of older adults and really saw opportunity to make people's lives different and better, regardless of their story or the challenges they were facing. And so almost 30 years later, I'm here as the CEO of a company that does the work that I've done in my career, which is really guiding people on the path of aging.
Yeah. So walk us through a little bit. LifeCare Advocates. Can you walk through and give everybody an idea, maybe a broad stroke of what LifeCare Advocates is all about? And what is it you guys do and how do you interact with people?
Yeah, so the team that I work with, that is with our company in Newton, Massachusetts, we're a mix of master's level social workers. We have some nurses, occupational therapists, physical therapists. So LifeCare Advocates is a practice in Newton, Massachusetts, and we are a team of a mix of health and human service folks, which is generally who is part of the Aging Life Care Association as well. We are a team of master's level social workers. We have some nurses, physical and occupational therapists, and we're all experts in the area of aging. Everybody has a background in working with, some of our staff prior to coming to us worked in the hospice area, assisted living, home and community services, but everybody's experience is extensive in the areas of aging. And then we're all members of the Aging Life Care Association. It's a national association that has people that do what we do across the country. It's an amazing resource for people going through aging themselves or those who are caregivers. And again, it's health and human service providers who are experienced in all areas of aging. And we really approach it in a holistic way, looking at our clients and their unique needs, and then helping them navigate all things aging, really.
Yeah. So I think there's two different parties here you probably work with, or at least are impacted. Number one is the direct client, and then the other one is the caregivers. Can you
Yeah.
walk through a little bit as far as, as far as with the caregivers, maybe some challenges that caregivers are going through and maybe some things that they might see coming up? Can you kind of speak to that a little bit?
Sure. Yeah, caregivers, the numbers of caregivers are increasing. And you mentioned your own story. I do this for a living, but I also live this every day with my own in-laws and parents. And because of the increase in older adults, caregivers are really, a lot of our focus. People do call us to get assistance and guidance around how to help an aging loved one. So we're working directly with caregivers to help find resources and navigate what's out there, which can be really confusing and overwhelming, quite frankly. And then often we are called by an older adult themselves. This has been part of my dream as an aging life care professional, is really helping people early on in their aging journey directly make plans and impact their choices. So I'm happy to see over the 30 years that I've been doing this, that the calls are coming less and less, although still that's there. Calls are coming less in crisis and more, wondering what's next, either for an individual or for a family member. So that's really part of our role, is to help people in whatever phase of the aging journey they're in find the appropriate resources. And we really are customizing that to their unique story and their unique needs.
Do you find that people are not aware of what resources are available to them?
I do. I think part of it is a lot of times, and I'm assuming in the financial industry, I think we have a lot of things in common, I'm guessing, where people should plan a lot earlier. They should begin to have these conversations, and yet they're busy and it's easy to say, I'll look into that later. And so I think people often find themselves sort of at the cusp of a need, or really knee deep in a crisis, before they start realizing, I know nothing about what's out there to assist my loved one or myself in aging. And I think the other thing is, we as professionals sort of have a term, the Google curse, because I think, nowadays, you can pick up your phone or, quickly Google something and find out that, oh, there's all of these resources, or this is covered, or this is free. And, oh, this sounds great. And, really, it's only part of the story, as we know. And so, unfortunately, people end up with just enough information to potentially really make some difficult mistakes as they're at the most sort of vulnerable time.
We work with people, I think, in 48 states now across the country, and just a large number of people, right? And so I get the privilege over the years of just sitting down and talking to people, and my own personal clients that I work with, having done this now, this is our 30th year anniversary, so that starts to age me a little bit, right? Similar to you.
Yeah, me too. I get that.
I think what it does speak to is that it's the blessing of being able to walk through life with a lot of people and to see from them and learn from them. Carrie, I've noticed over the years, a lot of people, they actually seek care a lot later than what they should. And I don't know, is that because of the caregivers, are they covering for the client, their loved one? Is it because they're not sure what signs to look for? Do they just see these new behaviors as things, should I be aware of? Should I not be aware of? Is that just them? What do you see in that? Why do people wait so long to seek care?
Oh, there's so many reasons, I think, but a lot of times it's because it's a difficult conversation. You may see mom or dad, if you're a distant caregiver, you may see, we're coming on the holidays. You may see mom or dad once or twice a year. And so, you're really not noticing the nuances and the changes. You're also maybe not aware of what those changes mean. It might just be I guess they're just getting old. A lot of times what people think is sort of normal aging is actually not. We're not supposed to age with aches and pains and forgetting where my keys are. I mean, I do that, but you're forgetting what a clicker is for and trying to make a phone call with a remote. These are signs of cognitive decline or potential issues that really need to be addressed. And the truth is, the earlier we can address them, the more choices people have and the more ability to navigate their own path, whether it's the older adult or the family member. And so, but why people avoid it, it's like anything else. Having a conversation, I'm in Boston. How about those Red Sox? That's about easy. That's a lot easier than, Dad, I noticed that, she looks disheveled and seems confused. And,
Yeah.
What's going on? Those are hard conversations. And so families avoid them, until they're really in front of them and they have no choice. And often that is too late, or it's much later than they could have had some opportunities to make decisions or allow the loved one to help with choices where they may not be able to do that now. So we see that quite often. And, our job is educators and advocates and consultants is to really help people, get the word out, doing podcasts like this, talking to people that are just beginning to see themselves as caregivers, really helping them to say, what do I need to ask? How do I begin this conversation? And those are ways that we can help as aging life care professionals, really help them begin to start the journey, and I really try to help remind people that having these conversations, as difficult as they are, if you're doing it proactively, it's a lot less difficult than when you're doing it in the throes of a crisis. And, it's sort of, I use the term, it's aging by choice and by design rather than by default.
It's just so interesting. Stacey and I have been talking about a lot with both of our parents that, when we look back in time, the last 2 or 3 years, the facts that we know now, we can look back and say, well, that was something we should have been aware of. That's something we should have seen. But you have the lens of hindsight being 2020 and
Absolutely.
see things, but I think there are things that as we start to educate ourselves more and even talk to our friends that work in the field where you work, Kate, and that professionals that and got ourselves involved in resources, we were able to actually learn more so we could spot more signs and be able to share that message with other people. And folks, I want to encourage you in the show notes, we have contact information for Kate and links to website as far as over to LifeCare Advocates and a lot of phenomenal resources and tools that they have available. And so if you're sitting here listening and thinking, man, I really need to educate myself more, I need to be aware of what resources are available and things to look for, and even how to start conversations, definitely check that out, reach out and find a way to connect. Kate, can you help me understand? Because I'm kind of lost on this differentiation.
Sure.
So we have a lot of people as they age, sometimes they're just getting forgetful. And which I lost my wallet last week, so maybe that's part of my aging. I don't know. But sometimes maybe that's dementia. But there's also maybe a diagnosis of Alzheimer's. What is the difference of the two?
That's a great question. And people often it's sort of confusing because people think it's synonymous, those two are interchangeable, and they're really not. Dementia is actually sort of the large umbrella under which Alzheimer's falls. So dementia is a broader sort of sweeping diagnosis of a cognitive decline or impairment that could be a number of things. So signs of decline in memory, awareness of sort of individuals, or sort of losing, sense of what day it is, or having repetitive conversations. Those could all be signs of a cognitive decline, but they may or may not be Alzheimer's. There's others that may be more, people may hear of things like, there's vascular dementia, for instance, which can be caused by people with different conditions, and it impacts different parts of the brain, and it does present a little differently. There's Lewy body dementia, which is a dementia that often the paramount sort of the signs are more changes in behavior. Sadly, there's a frontal temporal dementia or young onset where people are often misdiagnosed initially. Their behavior changes are such that, quite frankly, it looks like they're just making really bad decisions or they're losing their inhibition. So there are a variety of ways that dementia shows up, and Alzheimer's being one of them, which often is at the beginning stages, really beginning to see someone who, may get lost, for instance. They've driven the same route all their lives, and, they know how to get with their eyes closed to their daughters across town. And then all of a sudden they get in the car and you get a call from the police, and, mom who normally goes there never showed up. And it turns out she's, miles and miles away and lost. That's a real big indication that something has changed. And, a lot of times people will say, oh, If they're declining, why do I need to know? What does it matter? I need to just figure out what to do. The reality is getting a good diagnosis, especially nowadays, we really have so many diagnostic tools, and those diagnoses can often really help us design a care plan because, as I mentioned, the behaviors are different, the resources may be different, the strategies in helping that person can be different. So getting a good neurological workup and getting someone to someone that can help them begin getting diagnosed and then really helping navigate what options they have can really be a game changer on that path.
So that journey of diagnosis, where does that begin? Is that with a primary care physician? Is that reaching out to LifeCare advocates and someone like someone in their community
Sure.
like that, or is that
Right.
working with their neurologist? Where would they even start that journey of diagnosis?
Any and all of those things, honestly. A lot of times people do, if they are aware of the Aging Life Care Association and those that do this work, aging life care managers and professionals, they can start there because they don't even know where to begin. They're seeing these nuances, but they don't know how to bring it up. There's often siblings that have different opinions of what's going on. Oh,
Mm.
mom's fine. She's just getting older. I talk to her every Sunday and she
Yeah.
says she's fine. She sounds good on the phone. That's that sibling across the country, and the daughter who's living next door is really seeing a very different picture. So using an aging life care professional can be really a great way to start.
Mhm.
We're objective professionals with skills of assessing someone, holistically and understanding all of the impacts and the areas of what might be causing something. It could be a medical issue that is treatable. It could be a beginning decline, and then therefore we might be able to help navigate the medical professionals that one would need. Sometimes the PCP is the first stop because that's what insurance requires to get unfortunately, it's
Sure.
not always a straight line. And quite frankly, I will tell you, in the field of aging, professionals that specialize are hard to come by, and they often have long waiting lists and are very difficult to access. So sometimes using an aging life care professional can be useful because we may know who's accepting new patients. We may have contacts that helps you get into a practice. So certainly if you have the means to do that, that's a great way to start. And you mentioned, the Aging Life Care Association is a website, w.aginglifecare.org. And you'll see, if you go to that website, you'll see a big orange button that says find an aging life care professional. And if you click on that button, you can put in your zip code, and then you can drop down to 50 miles or whatnot. And then you can, find someone in your area that practices and has those local resources.
So let's say someone then they walk down this journey and we have a diagnosis of dementia. And it's interesting how I think you just educated so many people on this broad umbrella of dementia. And that is really represented in a lot of different ways. And they're all different focuses, right? And so
Absolutely.
challenges. And so we have a family now that is a primary advocate or a caregiver or a loved one, and when they could fill any different roles, right?
Yeah.
How do they really balance out the care and making sure that we have safety, along with for making sure you have independence and dignity and all of that? Is that difficult to balance?
Absolutely. I think we can all say if you're doing any of this personally, it is a challenge because who of us, you noted, when I'm saying I've done this for 30 years, it makes me realize just how old, the age of old is. I keep pushing that off. But the reality is, yeah, independence is important to all of us. I mean, we started at, whatever age you were in your state where you got your, first car keys and hit that road. That's a sign of independence. So no one wants to be told they can't do something anymore. So it is it is a balance. I will say that one mistake I think families make is because of their concern or emotions attached. When they see mom or dad decline, they begin to come at the conversation with, you can't, you shouldn't, you need to stop, or you need to start accepting help, stop driving. You can't do this anymore. I would recommend that is not a good approach. It typically is the place where you get that, wall of defense, and that wall is very hard to bring down once you put it up.
Yeah.
We really try to talk to people, and one of our roles is often having that first conversation with families and educating them about these nuances. People often are astonished at how we as professionals can approach mom or dad in our engagement And all of a sudden we're coming out of a meeting with a plan for, discontinuing driving or accepting some help in the house. And families will say, I've been asking them to do that for years. How did you do that in one visit? And by golly, it's not always that easy. But the reality is we're not their family.
Yeah.
And we're trained professionals with a distance and a strategy to say, you know what, I'm noticing this is getting difficult. Or your daughter shared that she's a little concerned about this. We see this all the time. How about, or what would it be like for you to consider accepting someone in the house once a week? Because going down those basement stairs where you had that fall is pretty difficult and dangerous. You say you want to stay in the house, this is how we know to help you do that. So it's strategizing in those conversations and approaching it, again, early and often. I often say, keeping the door open is, Dad, I know you don't want that right now, but can we talk about when we might try that, or when would you be ready? What are the signs? So really relying on what we do professionally is really relying on what's called motivational interviewing, because I'm asking you not what I think, I'm asking you what you think. You're telling me what's important to you. And then we're talking about, you're saying it's important to, walk down the aisle with your granddaughter at her wedding, but you refuse your physical therapy. So I'm curious how you think that's going to work. And then it puts it back on you.
Yeah.
You're the one that has the agency to decide. Those are some strategies and ways that we can balance that without shortcutting someone else's right to have a choice and dignity. And we then balance, risk versus benefit, because there's risks in everything. There is no absolute. People will say, I think Dad now needs to be in a nursing home because he's not safe at home. And one of the first pieces of education we provide people with is even nursing homes have falls, or there is no 100% absolute. So let's talk about where the ability to remain independent or with dignity in their own home and safeguards, while allowing for, some risk, but the benefit outweighs that.
Yep. Let's do it. Okay, I love that. There's so many ways that we navigate this and you have conversations, and yet we've kind of reversed roles in a lot of regard. That's hard to navigate that. And so, folks, if you live out there, also the greater Boston area, out in Massachusetts, and you're like, hey, I need to get some more assist on figuring out how do we have these conversations, definitely check out, Kate over at LifeCare Advocates. And if you live in a different part of the country, Kate gave us a wonderful resource at aginglifecare.org. It'll be in the show notes. Make sure you check that out. Phenomenal resource. And we've just talked about dementia, we talked about Alzheimer's. There's many other things that really kind of go into that healthy aging conversation.
Yeah.
It's not just dementia, it's not just Alzheimer's, but so many other areas. In your experience, what are some of the most overlooked areas as far as for how individuals can age well, and they be very proactive about that?
Sure. Yeah. I mean, proactive aging and wellness is sort of one of my absolute passions, really, because I think no matter what age someone is, we can improve their aging experience. I'm a firm believer of that. We can bring quality of life. We can bring, opportunities to have joy, despite changing physical or cognitive decline. I think bringing wellness really has many, many meanings. And really it starts with what does aging well mean to you? And often we see people who struggle because, they may not be able to do things in the same way they did. And so they stop doing things altogether. That leads to isolation. It can lead to decline and depression, which is sort of a spiraling impact on cognitive wellness. And so we really try to help people, and certainly the earlier the better, looking at how do we continue to feel like belonging, purpose. How do we help? What do we know? I mean, there's so much research now that we can impact with diet, brain health, diet, engagement. All of those things are meaningful. COVID also taught us the real serious impact of isolation and how poorly we do with isolation. We're meant to be in community. We're connected human beings, and really aging well often means finding your community and continuing to work at that. So those are all of those things and so many more. There's ways to adapt everything. We had a client who we worked with who was an avid sailor throughout his lifetime, and he had Parkinson's and many other challenges. and really believed that, and was very depressed. He had lost his wife. And we, with our engagement program and our care managers, were able to implement some adaptive sailing for him. And it made, it changed his life. He had passed away, but after this experience, but we were able to do that and other things that helped bring joy to his life. And really at a point where he thought that wasn't even possible anymore.
Yeah.
So really looking at what we know about, one thing we approach things is called, it's really the concept of person-centered, strength-based approach, really looking at what people can do. We're so inclined, and, you see this with older adults, they come out of a hospital and all over their paperwork, it says they can't do this, they can't do that. We focus on what's wrong rather than what's right. And so strength-based approach is really looking at what remains. And that really is one way I can really tell you is a huge impact on wellness.
That strength-based approach, I know that you've done a lot of study and personal application as far as an applied positive psychology. And that I'm sure that applies to
Absolutely.
that, right?
It really is.
When I think about that, it really gets me in a lot of ways excited about potential future trends.
Yeah.
What are you seeing in this space as far as future trends?
Yeah. Oh, there's so much, I think we're on the cusp of so many things. I think there's, we're always looking at and learning about technology. I think that, technology can be our friend. Learning how to work with technology and couple it with human space and human touch and human engagement. Things like being able to do this on Zoom in different states and, ways that we can keep people connected. That is really a very big future trend. I think one of the other trends, sadly, that we know is that there will be, statistically, more older adults than people to care for them in the coming years because of the baby boomers, because, people are living longer and then people, are having children later or not having children as a choice. So people have less people in their lives and to care for them. So the trend of looking at how we enhance people's engagement and support and services with technology is always on the cutting edge. I straddle both worlds because, I believe in the work we do in a human connection that technology will never replace. But I do think, and we're always looking at how do we bring this together, bringing families across the country together. Our company actually has had the benefit of doing some pilots with technology, safety and monitoring. And then also we actually were very excited to do technology with virtual reality and using that with some of our clients to, clients who now are in a nursing facility or homebound using virtual technology to go skydiving or visit their home they grew up in or take a tour, through another country.
That's
All technology.
Yeah, that's a phenomenal resource to have. And I mean, what a way to bring back some of those sharp, phrases that were so impactful in their lives and incredible things. It's actually very exciting what we're seeing things happen. And, Kate, as we're kind of wrapping up here with decades of experience and study working with so many people, what would you say has been the most profound lesson that you've learned about aging, caregiving, and the human connection?
Wow. I mean, endless. And what I would say is the reason why I continue to do this as long as I have and will continue to do it is because I'm always learning. We learn best from our clients and their families. We're so honored to be part of their journey when they allow us. And so, but some of the things I think, and I'd love people to take away, is you're not alone on this journey. I think the role of caregiver can be very isolating, and people think they're the only ones going through this. They struggle with strong emotions of balancing wanting to care for a loved one and quite frankly, feeling angry and resentful. And, their lives are impacted in so many ways. So I think that connection of belonging and finding resources, whether it's friends that go through the same thing, community groups or support groups, which can be done virtually, and also getting help. I can't say enough about how helpful taking a break, getting some respite, getting a different point of view can bring benefit to caregivers and to older adults. As aging life care professionals, I think that is one of the biggest things when we begin to work with a family or talk to a caregiver that calls us really at their wit's end. And when we get off a phone call and they say, I can't believe I didn't get your help sooner, or I feel better already, just knowing there's help, and people in tears really feeling like they thought there was, there were really no answers. you know, and while we can't make everything perfect or better, having someone to help you navigate that journey and really take the burden and share that burden, I think can be priceless.
Phenomenal. Kate, thank you so much today. It's such a phenomenal resource. And folks, make sure you check out show notes. There's some great links in there. Reach out to Kate. And as far as organizationally, reach out to, the organizations that were mentioned. The aginglifecare.org is a phenomenal resource. And we all walk through life, but we don't have to walk through alone. And let's lean on each other. And so, everybody, thank you so much for listening again to Great Decisions, Incredible Lives. We'll be back next week, same time, same place. And again, looking forward to chatting with you. Talk to you all later. Bye-bye.
Thank you again for listening to the Great Decisions, Incredible Lives, Retire with Intention podcast with host John Creekmur. Follow us on social media, visit our website, and join our community of like-minded individuals redefining retirement and living incredible lives. Please leave us a review and share our podcast with others who may benefit. We wish you a future filled with purpose, fulfillment, and the joy of living your incredible life in retirement.